Hi, I'm Ellen MacKenzie, Dean of the Johns Hopkins Bloomberg School of Public Health, and it is a pleasure to welcome you all here to the Johns Hopkins Health Policy Forum. This is the seventh installment of a series that brings leaders together to discuss pressing health challenges and how to approach these challenges through effective policies. For today's fireside chat, I am thrilled to welcome Michelle Lujan Grisham. She is the governor of New Mexico and a fierce advocate for improving lives through better health policies. Now, I had the privilege of hearing the governor speak at the most recent Bloomberg American Health Summit, which our school hosted back last December, I believe it was, in Philadelphia. And I was inspired by her words then, and so I'm particularly excited to have the opportunity to speak with her today. Governor Lujan Grisham is a 12th generation New Mexican, an attorney, and the first Democratic Hispanic woman to be elected governor in U.S. history. During her time in the governor's office, she has really shone as a policy leader. In her first year, she oversaw one of the most productive legislative sessions in state history, converting a broad package of bipartisan bills into law, including an historic investment in public education and a landmark transition to clean energy. And just last month, Governor Lujan Grisham signed into law 5 healthcare-related bills, which support and strengthen the state's healthcare workforce and make healthcare more affordable and accessible for the most vulnerable. Prior to her role as governor, she served her state as a cabinet secretary in both the Department of Aging and Long-Term Services as well as the Department of Health. In those roles, she was a dedicated supporter of senior citizens, veterans, and people with disabilities. She successfully fought for investments in healthcare infrastructure and innovative programming. Governor Lujan Grisham is also an outspoken supporter of reproductive rights, gun safety measures, and protecting the environment. Clearly, she's a powerful voice for public health priorities, and she's deeply committed to improving access and care for her constituents. I think we'll have a lot to learn from her today. Governor Lujan, welcome. It's such a pleasure to have you here as our guest.
Oh, Dean MacKenzie, that was far too generous in introductions. But the work that you do nationally creates opportunity for policymakers such as myself. And I'm very grateful to have another opportunity to participate. And I'm actually hoping that to take away some renewed strategies and ideas, because this is a country, I'll then lean into the questions. This is a country that could do far better in health outcomes, and the underlying root cause for at least someone like me is the fact that we don't respect public health initiatives and investments. So we never get in front of these issues. We pay the most expensive aspects later for acute and specialty care, and even then, it's not really accessible or affordable for most Americans. To get it right, public health initiatives are the only way forward to equalize access and outcomes for every single American family.
That's a wonderful introduction, Governor, and we're definitely on the same page. So it's great to have you here with us today. Let me start with some questions about your journey. You have served, as I just mentioned, you've served New Mexicans as a congresswoman and a cabinet secretary, and now you're embarking on your second term as governor, and I should add a big congratulations there. It's great to see. So I'd like you to tell us a little bit about your journey and how you got to where you are today, and what motivated you along the way. And I'm particularly curious to learn how you first became involved in policymaking and what excited you about doing this kind of work.
I really appreciate the question, because my path to this incredible work certainly was not a straight one. It was incredibly jagged and crooked, with no real plan in front of me. It was quite by accident. I did some work in nuclear energy. Right out of college. I had an engineering and science and math background, and I didn't have a degree in engineering, and so I wasn't really in a place where I could move in that job. My grandfather was the first Hispanic Supreme Court justice in the country, and the first one in the state of New Mexico. And he was really interested in me furthering my education by going to law school. So I got married, I went to law school, I had 2 children, which during law school, which meant I had a mortgage. And so I wasn't too choosy about the work that I was involved in, right? I was just really concerned, like most young families, making sure my family was secure and safe. So after law school, there were very few jobs that were going to work with me raising 2 children, young children. And I fell into a position at the State Bar of New Mexico. So every state's got a thing, an association that works for their lawyers and keeps your licenses. And I volunteered there to pay off my license dues as I was trying to navigate getting a job. And the program I volunteered for was called Lawyer Referral for the Elderly. And in 6 months, I was running that program. That was the program that changed my life and my perspective about everything is too hard to navigate. That marrying the private sector and the public sector, frankly, is still rather a nightmare. And I was serving and advocating for senior citizens who had any number of issues, and they were incredibly difficult if I didn't address long-term care access, which if you're just on Medicare, you can't. Families couldn't do the caregiving. So I had to learn healthcare policy. I had to learn how to navigate it and bring folks together. And that led me to want to be a policymaker and change the very laws that I saw as barriers to people to getting the services that they need. So quickly, but as an example, I could get you in the hospital in Medicare, but I couldn't keep you at home safe. I couldn't get you into an assisted living or a rehab center. I couldn't get in-home care, which was far cheaper and more dignified and allowed for the investment in independence in a population that deserves both that dignity and that self-determination. Those things led me unequivocally to want to be in public policy. And that's how I became a cabinet secretary. I bossed around a bunch of governors until one of them would hire me.
Well, it's a great story, and it just goes to show that an experience like that can just change your trajectory so much. I appreciate that insight. So, following up on that, given your history, what advice would you have for leaders today who are thinking about becoming leaders like yourself in public policy?
Dean, I love that question. And so thank you. As we're all trying to navigate a post-COVID world with a transformation in the workforce and a sort of renewed commitment. I'm of that age where there was no work-life balance for women in particular, but really for anyone. And now we're really leaning in to, I think, effective public health policies as well, right? So that people stay home longer. We've got longer parental leave, not just maternity leave. In New Mexico, we shifted our Medicaid benefits so they don't just follow the child for that year or two. They stick with the mother so that we can do more in the area of maternal health, because as you know, those outcomes are poor in this country. And I'd love to tell you that we're not in that mix, but we are, and we're going to change that immediately, because we know that those are drastic issues because we sort of left families behind. So I'm from that era. And now New Mexico is doing all the paid leave and all of the paternity and maternity leave that really balances those issues. So as we're figuring out life balance work, I think that young people in particular and workers want something they're passionate about, not just something they're educated about or developing experience in. The best thing about public policy is that you marry the research and all the evidence-based work, and you get to see it transform the lives of individuals, families, and whole communities. And I believe that reward for your work creates a vocation of sorts that I think will re-energize a workforce. And so my advice is, if you want meaning in your work, in the same way you want meaning in your personal life, this is a body of effort that needs you. You will love doing, and you can see again that you're transforming whole lives and changing the trajectory. And that's what this country needs right now, in my view, more than anything. Everything is a public health issue. Gun violence is a public health issue. Poverty is a public health issue. Environmental consequences from energy is a public health issue. All of these disenfranchised populations, all of the equity barriers are all public health issues. And when we address those, our economy is better, our families are stronger, our risks are fewer, and all the other systems that are really struggling, right? Healthcare, we don't have enough providers. Well, we minimize the kind of stuff that you need in person because we've created a much healthier, resilient population on the front end. And I hope that Bloomberg, that all the work that you all are doing, I think is really inspiring a renewed focus on public health. And I am so grateful for that, because it really is, I think, the overarching game changer for the country.
Yeah, it's been great to see the renewed and the increased interest in public health. You know, our applications, as is true for schools of public health around the country, have just soared since the pandemic, because people are beginning to appreciate the role of public health, and it affects every part of your life, as you've said.
Yeah, I think that for too long, public health was considered, I'm a public health nurse in a vital records, right, environment. So I'm in charge of birth certificates and maybe some early programs like WIC, making sure that young mothers and young families understand the nutritional aspect of meeting the needs of their new child or young family and themselves. But it's so much more than that, or it was all research or population data like epidemiology, all critical components, but it's so much bigger than that. And I do think post-COVID, this is a huge opportunity in this country. And we want to give you a run for your money where you are. We are on our way to figure out a school of public health at our renowned University of New Mexico, which is has a spectacular reputation in healthcare, the med school, and bioscience. So let's make sure it has an equally spectacular reputation in public health.
Well, that's great to hear. That's really terrific. So I want to get to some policy issues that you have been championing in your role. And let me start. You've already mentioned poverty, and you have spoken very passionately about poverty as well as systemic racism as drivers of poor health. And you have been so bold as to say that the only way we're going to tackle some of the most challenging health issues is really to eradicate poverty. And I think that's such a bold statement. And I'd love to hear some of the approaches you're using to accomplish this incredibly audacious goal in New Mexico and address the root causes, as you say, the root causes of our health inequities.
I really, and again, it's generational, as you know. So the longer this country waits to eradicate poverty, the wealthiest country in the world, makes no sense that we have people who are living without housing or substandard housing or in high polluted areas without transportation and access to any basic services, who are hungry, is an outrageous aspect. And I would love to boast that New Mexico has no poverty and no high risk or disenfranchised populations. But the exact opposite is true. And it's true for a number of reasons that I do want to provide background for. Hispanic or minority populations all around the country have long been hard pressed to sort of get to that middle class and beyond as a population group standard. which means generation after generation, and for a number of reasons are more likely to have larger families, which means more difficult then to feed and support and house. In addition, we know sovereign nations have long been excluded in the right self-determination, economic effort, and individualized services because they're sovereign nations. We have an extraordinary number of individuals in both those two population sectors. So when you take the Hispanic population, and we're a minority majority state, you're going to have a higher concentration statewide. And it is thousands of years old for some population and hundreds of years old for others. So we're not Pollyanna, neither am I, about the challenges here. And so we're often, tied or in the last of the states in the United States in terms of concentration of poverty. So I intended for it to be bold, and we're going to do it. And we're showing actually that we are making significant progress. So the easiest way, you make sure that education's available for everyone and fair economic support. We're not even talking about wages. We talk about salaries and independence. So we've increased salaries in New Mexico from about an average of 40,000 to now 60 and 65,000 when we're involved in the economic development aspect. We raised the minimum wage. We have done more than 100 million, and more is coming in food insecurity measures. So we've seen the fastest drop in food or hunger insecurity or security in the nation. And we're the only state moving out of poverty at a clip that's meaningful in the country. And this is the other way that we've done that. We've done that by making sure that childcare is on its way to be universal. It's up to 400% of poverty. It's completely free. There are no copays for families. The goal, and I think we're going to get there in just over a year, completely universal. There is everyone, anywhere, everywhere. Not only is it free, but it's available. So we're standing up and we're paying these workers more than they're being paid around the country. And we leveraged federal funds and state funds. And we changed our state constitution so that the funding source is perpetual, which means that really families in New Mexico now have a constitutional right to childcare, universal pre-K, extended learning, and tons of investments into our K through 12, and they need them. And we're expecting really remarkable outcomes, including structured literacy programs and beyond. And now we have the country's most robust free college program. So 2-year, 4-year, part-time, anytime, anywhere, trades, skills, and we're creating now a film academy. Same thing, making sure that workers can become entrepreneurs and compete in ways they never have before. We've increased salaries for every essential worker where largely minority populations find themselves in these vocations. Nurses, educators, childcare workers, pre-K instructors. Well, now they're being paid higher here than anywhere else in the Southwest. And my goal is to have the highest paid education, public health, and public safety workforce in the nation. So again, drawing out those specific issues. And last, I announced at your last conference that we were going to be a universal meal state at schools. And now we're the first state in the nation to have both universal meals. We don't charge kids for meals, meals before the bell, meals after the bell, lunches, snacks, food to go home. But in addition to that, they have to be healthy. So scratch cooking, huge investments in new infrastructure, contracts with local farmers and ranchers and growers. And we aren't going to stop until these meals are meaningful, changing then the nutritional balances for families who have long been at risk. Hungry kids don't learn, can't in the same way. We put them at risk the day they go to school, and we're not treating that as a public health issue. In New Mexico, we are, and I'm incredibly proud of that work.
Well, kudos to all that work. And I think you're setting an example for the country. And I hope other states are listening and watching what you're doing and following suit. So,
and we're going to put in nearly $1 billion in housing so that we're building affordable, safe, housing for families who
Yep.
also can't navigate that in this country. And the same is true in New Mexico. And I wish it weren't, but we are now socking away these resources and devoting all government. So we bring a children's cabinet together. We do the whole of government. Everyone, every department, corrections has a role in eliminating poverty and supporting children. And when you tell every leader that that's part of their job, it changes the dynamic of how we approach every problem. It's everyone's problem in the state,
And it's
and
all
it's
public
everyone's
health.
opportunity. You bet.
Right. Yeah. Yeah. Fantastic. Well, let me switch gears a little bit. And if we could talk a little bit about women's reproductive rights. As we know, we're facing new restrictions at both the state and federal levels. And can you talk a little bit about your biggest concerns when it comes to abortion access and more broadly, access to comprehensive reproductive care overall? And how are you addressing some of these issues in New Mexico?
I'm going to tie it first because I think people are really clear that if you're a public health expert or you follow evidence-based information, you're clear that women's reproductive rights are a significant public health issue, not the least of which is giving families and women the tools they need to do effective family planning, which has everything to do with education and contraceptives and early screening and the kind of overall primary care that women and families must have. And we have a tendency, I think, to focus on, after a pregnancy. But there is so much upstream work that gets eroded, eradicated, and shifted by what the Supreme Court and others are doing by trying to control women's bodies, to control that decision-making. And the question about abortion access after the Dobbs decision, for me, is the beginning of removing rights from women. And again, this notion that the states can decide. You can see that they're working, my political view is these are all efforts, they always have been, to create a national abortion ban, which is the worst policy, the most draconian, and rolling the clock backwards. I mean, we're not going back 50 years. We're now going back 100 years without access to contraceptives. It's despicable. So in our state, we joined the Reproductive Freedom Alliance so that governors are leveraging and working together. So we make sure that if there becomes a supply issue in these legal debates for contraceptives and medication abortion, we're ahead of that. We are investing, in direct dollars into making sure that primary care clinics dedicated to women who will also provide safe abortion and abortion care are available in our state. So we're making those investments and expanding those services. We've made it clear that we'll use our public health resources. So another area where public health nurses for screening and sound evidence-based advice and family planning support, and all of the work that goes in, including fertility education support, and then further access to specialists. All of that can happen in a public health environment in state government, and we are deploying that to make sure that that's available. K through 12 age-appropriate sex education and school-based health centers that also age-appropriate provide access to contraceptives. We've also eradicated for teen girls, making sure that they have free menstrual products in school and with no wrong door. And those are available at public health, really creating an educated generation of women and families who are clear about their rights and their protections. And then we've signed into law in New Mexico, we codified your right to abortion care and access. We have codified that we will not cooperate on a criminal basis or a civil liability basis against providers with any other state, that's protected private information, and we're going to stand by it. Now, the last pitch, and this is all now codified in statute in New Mexico. We need a generation of advocates, men and women. We have to also be clear that this extends also to gender affirming care, which we have also protected that right and access in New Mexico. We need advocates to be really clear that this is a country that should be expanding individual rights about bodily autonomy and freedoms, not restricting those, and particularly in the health area. And I'm going to keep fighting until every woman in America, because last thing, they're having to travel. Who pays for that? What happens if they have young children at home? What happens if the choice is to deal with a life-saving issue in a procedure and losing your job?
Yeah.
These are chilling aspects that aren't, in my view, getting enough attention in this debate about bodily autonomy. Women will die, families will be hurt, children will be hurt. And these risks will grow exponentially. And we do have risks. The poorer the household, the more likely that you have trauma, lack of food, lack of housing, instability in parenting. And if you don't have access to healthcare, behavioral health services, an increased likelihood for self-medication, which could lead to drug abuse and alcoholism. Huge risks. And all of that is impacted in huge ways by limiting bodily autonomy and safe care for women, life-saving care in many circumstances. We're going to keep fighting, Dean.
Yep. And as you point out, it's all interconnected. All
of
the
it.
issues you're talking about. Yep. Now, some of the issues we're talking about are disproportionately affect indigenous communities, indigenous populations. And I know, obviously, New Mexico has a very large indigenous population. So can you talk to us a little bit about what you're doing in New Mexico to work with indigenous communities and address their most urgent needs?
Absolutely. Now, I'm going to do a shout out just to the sovereign nations. Again, these are populations who were moved from their ancestral lands. They were boundaries were falsely created that disproportionately impacted their access to every resource, including clean water and access to electricity. So let's be really clear about what this country, including New Mexico, created in that context. And so we've long debated, what are sovereign nations doing? What can we do to support them? So number one, sovereign nations in New Mexico are incredibly resilient, independent, and forward-thinking. And I want to give them huge kudos for standing up their own public health systems, their own health centers and community health centers, by investing in their own early child education, by preserving language. We're now actually fighting with the feds to make sure that the Bureau of Indian Education educators get paid as much as the educators do in New Mexico. That is a discriminatory factor that we aren't going to tolerate. So we're going to keep fighting that gets included in the budget. So they're doing incredible work. Their economic development strategies are really paying off in New Mexico in terms of all of them. And today, I just did $100 million. It's the largest ever investment in sovereign nations for their own successes and self-determination. And what are they doing with that? Well, they're creating energy independence. They're doing energy transitions, including, decarbonizing transportation. They're bringing water to their communities. I can envision, I can see it, I can taste it, that the Navajo Nation is going to have community solar, that they're going to be completely off the grid and do grid modernization. We are running as fast as we can to get fiber to every household. In the Navajo Nation, that may not be possible. So we're creating strategies, and I'm fingers crossed, hoping to deploy new technologies, including a company called Sky that uses basically balloons to hover in areas that can bring you access to the internet without laying fiber. So that we're not waiting for these things. We're dealing with them in real time. And most importantly, the Navajo Nation does not have adequate access to clean water. 40% of the Navajo Nation on the New Mexico side hauls water. 40%. So we are now working with the Bureau of Reclamation. We got $1 billion on its way to New Mexico to solve that problem for the Navajo Nation. But I'm not waiting. until 2027 or 2028 or 2020. I don't know at the feds. They got a big country to deal with. So we're already creating water laterals, connecting people up, doing the infrastructure, drilling wells, and 6,000 people today, more than yesterday, have access to clean, fresh water. And I want to be able to come back on a program like this and talk about 50,000 and 100,000 people who are not hauling water. If you don't have access to clean water, I am not serious about changing the public health outcomes. And one last shout out to our, we've got a lot of work to do in chronic diseases with our minority populations. And diabetes is a long-standing killer. Healthy meals in schools, nutrition support, their work in that eradicates diabetes risk. So we're very clear about that. I'm very excited about that. And I want to give them a shout out. I don't know the exact number, so I'm going to ballpark it because I haven't checked with our bivalent boosters. But prior to the bivalent booster, and the new one that's available for at-risk and older populations, sovereign nations in New Mexico were between 96 and 98% vaccinated, all age groups. This is a population that is clear about what to do about their health and what strategies to deploy. And last, during COVID, the very first drive-through COVID testing and drive-through vaccination spot was for the Navajo Nation and the Zuni Pueblos. And it was in New Mexico where that started. So instead of sort of focusing on the challenges, I want viewers and listeners to focus on our sovereign nations are playing a huge role in shifting that dynamic forever. And we'll be able to deploy those strategies all across the country.
And what do you think accounts for that tenacity of the sovereign nations to really be out in front of some of these issues?
They have done an incredible job in New Mexico, and I'm going to also take some credit. I am really clear. They are independent sovereign nations. We treat them as such. We collaborate on every single issue. They collaborate on educational investments. They collaborate on college. We have a tribal college education fund specific to the nuances about where college entrance is more challenging for a tribal population. We have many tribal members as legislators and educators and doctors and nurses. And so you've got a leadership embedded. We have a cabinet of Indian Affairs. You've got leaders in significant committees in both our House and the Senate who represent and are members of sovereign nations in New Mexico. That body of effort has really shifted. But certainly when I ran in 2018, I said that we were going to be government to government. And when I announced I was running for governor, I announced it to sovereign nations because there isn't just one leader in New Mexico. There are 3 presidents and there are 19 governors. And we treat each other as equal leaders. And that has been a game changer in the state of New Mexico.
Yeah, great. I'm going to switch gears again a little bit and talk about caregiving. And I know that's an important issue to you, and it is somewhat personal. You were informed by your personal experience with caregiving. So could you talk a little bit about what you're doing in that regard?
Absolutely. So, of course, I was a cabinet secretary or lead. It changed. It went from a non-cabinet level and then got elevated to a cabinet level. But I was at aging for 14 years in the state of New Mexico. And then I went to the Department of Health for 3 years. And so caregiving is a international problem, the graying of the globe where we don't have enough people to provide that personal care and support. And really, for me, caregiving is both. It is providing dignity and respect and socialization, but it is unequivocally also helping to manage, healthcare issues and prescription drugs, and also all of your activities of daily living, dressing, bathing, eating. And the more that we do there, the longer someone can be independent and in their own home. That's good, because that means people are spending their Social Security income. They're still connected to their families. They're not isolated. I'm no fan of nursing home care, but for far too many Americans, it really is the only choice available to them and their families because we haven't done enough front-end caregiving. So I created a program in Congress that needs lots more funding. So I'm lobbying, called CareCorps, that changes it up a bit so that while I don't want to minimize paid professionalized caregivers, and in fact, we have a huge shortage in this country of personal care folks and certified nurse aides. This would take volunteers like a Peace Corps, train them in a Care Corps, and how fascinating would it be to get a college student who wants to take a experience sabbatical, or someone who wants to take a paid break in college. You get a stipend, you get training. We'll put you at the Navajo Nation. And while that opportunity is eroding quickly, my goal was to put a young person somewhere else in the country in a position to get to know a Navajo code talker and get that experience and really understand the role that the Navajo Nation played in securing democracy and winning the war. I think far too many Americans have no idea that communication strategy was delivered by the code talkers and those men and women who were serving their country. And in fact, it's in New Mexico, per capita, we have more Native Americans who are military veterans than any other population. It's an incredible dedication to patriotism in this country. So that was the goal. We've got it funded. New Mexico got one of the grants. Other states have those grants. COVID had a chilling effect on putting people in people's homes. We're also going to create a program called New Mexicare that is a bridge between Medicaid and Medicare, so that we're paying family caregivers to provide caregiving support who aren't Medicaid eligible by creating a whole new state program called New Mexicare. So we already have a pretty robust paid family caregiver program. I want it to be bigger and better. And then I want traveling public health primary care vans going statewide, providing the other supportive care. And we're launching all of those programs currently. And it is my passion. I took care of my mother until she died. I took care of my father until he died. I took care of my disabled sister in her adult years until she died. And I took care of my in-laws. So I have a long-standing practice, and it is a gift, but it is laborious and challenging. And when family members reach out to us, and it's a 20-page document and 2 books that you need to read just to figure out how to navigate garnering the information and authority you're going to need state to state. It is really challenging, and I will do it after I've been on this program. We're going to launch an education program for families about how to better prepare, more than living wills or advanced directives, and more than figuring out sort of what kind of things you want, but really preparing families for challenges, particularly for cognitive impairments that are likely to come the longer.
Hugely challenging. Yep. That's good. So we're getting close to the end of our time together, but we did ask our audience members to submit questions, and we received a number of great questions, and many of the questions that they posed we've addressed already. But one issue we have not really talked about a lot, although it's been mentioned, and one, again, that you feel passionate about, is the impact of climate change on our collective health and well-being. So again, I know New Mexico is out in front on some of these things, and I'd love for you to share with us what you've been doing in that regard.
Oh, well, thank you. What you mentioned in your introduction, our landmark Energy Transition Act, which decarbonizes utilities and sets very stringent and robust standards for them to be completely green and carbon neutral. And most of that was required by 2045. We're going to beat that. We're already moving towards 2040. And my goal is maybe we can do even better by 2035. In fact, one of the big challenges that states have is bigger utilities have the buying power for renewables to meet those standards, but the local rural electric co-ops do not. And I want to just shout out for New Mexico. The Kit Carson Electric Co-op in Taos County is completely green during the daylight hours, and with their storage efforts, and our microgrid and grid modernization work. I think in short order, I'm going to be able to highlight that we've got the first completely green rural electric co-op in the country, 24 hours, 7 days a week. We have the largest wind farm in North America. We're the cheapest place in America for solar. We're finishing up our second largest, transition work to transmission lines work, so that we're clear that we can deliver this energy all across New Mexico. We have very strict and stringent methane reduction rules that the feds adopted in large part, and other precursors like ozone. We don't allow flaring. We are now, people are seeing that huge fines are coming. And here's what's coming in New Mexico. We're there in baby steps, but I want it to be bigger. Soon, you will be able on your phone to see when we've got a methane leak and who is responsible for the leak, which company, and how quickly we got it cleaned up, so people know that their air is safe, their soil is safe, their water is safe, and we're going to codify net zero by 2050 in every sector. We didn't quite get that over the finish line, but that's going to get done. I already have an executive order. We're part of the U.S. Climate Alliance, and more is coming. And the big one, frankly, is decarbonizing transportation. I think New Mexico is going to lead the country in that space, and we're sort of waiting for a nod from the Department of Energy to that end.
Great. Well, as we're beginning to wrap things up, first let me say that I think you're doing incredible work in New Mexico, and I really do hope that you are showing other states what's possible with a can-do attitude, if you will, and a passion for making a difference. But I'd like to ask you one more question before we leave, and that is, we have a lot of students that join us for these sessions. So if you could tell us a little bit about how your you talked about this a little bit in your introductory remarks about how your education informed your career. But do you have any advice for especially our students who are listening in today?
Well, as I started about, make sure that your education matches the things that you really want to do. I'm a late bloomer. I figured that out in my 30s and 40s, and frankly, that I wanted an appointed or political aspect, in my 50s. So I encourage young people to not be risk adverse, take some of these risks. I love the joint degrees that I'm seeing around the country, and New Mexico could do better here, where environmental science is married with political science, which is married with public health in a more overarching degree. Be an advocate. Find a place to do that work, because not only will you improve your own life and improve the lives of the people in the work directly, you'll create a sea change for the country. And what the country really needs is that sea change. And young people, for a long time, I think, haven't been given the credit that they're due. They're beginning to champion these issues, including climate change, in grade school. And I'm old enough to remember when grade schoolers came home and challenged their parents to stop smoking. I believe I did that. My mom was none too happy about this advocacy training when I was in the first grade. But it had an impact, and I don't smoke, even though I grew up in a smoking household, which is a key indicator about whether or not, you will continue with that poor public health practice. And it's an addiction. Mm-hmm. Younger we engage students, and the more support they have for no wrong door to success, including paid internships, sharing across colleges, right? These experiences and educational platforms, including more work even on the internet where we share. So I'm going to challenge Dean MacKenzie to figure out a program that we can stand up, share, and do in a public health environment in New Mexico. The more cross-training, cross-degrees we're going to have, and the more young people are going to be, I think, satisfied and paid well, so they can raise their own families in whatever way they choose in that work-life balance. If we want to save the planet and we want to make families independent, We want to eradicate poverty and injustice. It's going to take a whole new class of young, dedicated professionals who are ready to take on the mantle. So I'm thrilled that they're watching and listening, and I'm ready to have you work in New Mexico. And there are many other states, including your own home states, who deserve you and need you. Let's go fix the world.
I'm with you. And we're already doing some work in New Mexico. We could do more. And I would love to have some further conversations about how we can get involved.
Done. You're stuck with me, Dean. That'll teach
Okay.
you.
All right.
All right.
I'm up for the challenge. That's absolutely terrific. Well, it looks like we're out of time. 45 minutes goes really fast when you're have so much to say. We want to thank you, Governor, for joining us here today. It's a real pleasure, so inspiring. And I just I want to thank you for the work you're doing, not just in New Mexico, but you're leading the way, for the country. And I'm an optimist, and I can see that you are too. And yes, we have a lot of challenges these days, but we can fix the problems and work on our strengths, based on our strengths, and we can succeed. So I appreciate your optimism and your can-do attitude. So thank you. Thank you.
Thank you for this opportunity.
Absolutely. And we'll get together again and talk about what we can do together. And then finally, I'd love to thank everybody who's joined us here today and who submitted such thoughtful questions. And we do hope to see you all at the next Johns Hopkins Health Policy Forum coming up in just a few months. So stay tuned for the next session, and please stay safe and be well. Thank you.
Thank you.